Need to straighten out your teeth? Should you go for Invisalign or for traditional braces? Hi guys, my name's Heather. I'm a dental hygienist, and in today's video I want to talk about the different options to help straighten out the teeth. Now first, you're going to have to go to your orthodontist because they're going to tell you what you qualify for. Not everyone qualifies for Invisalign, and some cases need to be put through traditional braces. So first, go ahead, schedule a consult with your orthodontist, but if you are given the choice, braces versus Invisalign, here are some things to consider. If you go through Invisalign or any other brand of aligner therapy, you need to be committed to the treatment. It's different from traditional braces where they put the braces on and then you don't have to worry about, wearing them because they're on your teeth 24/7. When you get Invisalign, the trays come in and out when you eat. And you have to be committed to wearing these trays for 22 hours out of the day. So basically you're just taking them out to eat. So you need to wear them through any social settings, through school, through work. So you have to be committed to wearing the trays. I'm going through aligner therapy and it was a seamless transition. The only thing I noticed at first was that I had a lisp, but it went away after a few weeks. Now it is a little frustrating to have to take the trays out to eat or drink anything besides water, but it's something that I've already gotten used to and I'm committed to it. Another thing that I want to stress the importance of is keeping your retainers or your aligners nice and clean. The whole point of Invisalign is so it can be invisible, so no one really should know that you have it on. So you want to keep your trays nice and clean, so you want to be committed to taking care of them using a ultrasonic cleaner or a foam cleanser. GuruNanda has some really good options to keep your aligners nice and crystal clear. People don't even know that I have them on, so that's what I use to keep mine really clean, because you don't want to have a dirty aligner and then put it back in your mouth. That can harbor a lot of bacteria, your breath can smell, and it can contribute to cavities. So those are some things to consider. You want to be committed to wearing the trays for 22 hours out of the 24 hours that we have in a day. You want to keep them clean, but from a hygienic standpoint, I love Invisalign. I notice night and day difference between patients that come in with ortho, traditional braces, versus coming in with Invisalign. The patients are going through Invisalign, their gums are healthier, their teeth are cleaner. When a patient comes in with braces, typically the gums are inflamed, they have a lot of plaque on their teeth, they're hard to keep clean, and then once the gums start getting inflamed, it hurts a patient to clean them more, so they just kind of ease up on the home care, which you don't want to do. A lot of patients, when they get their braces off, they have a bunch of cavities and gum disease. So as a hygienic standpoint, love recommending Invisalign as long as a patient can commit to wearing it. If you guys have any questions, let me know down below. But that's it for today, and I'll catch you guys in the next video. Bye.